All right, good evening, everyone, and welcome to Atp Live Monday. Thank you so much for joining us today. Um, thank you so much for joining us today. And ATP Live Monday is a program where you get to ask any questions that you may have about the health of your children in the next 16 minutes, and we'll try and answer them. So, welcome everyone. You can post your questions now. But while I'm waiting for you to do that, I'm just going to share the videos to all the various groups and links as well so that everybody can see it. I also encourage you to do the same for us. Um, so feel free to share and share. Okay, I'm trying to share. Okay, to my story and share to groups. Welcome everyone. Welcome those on Instagram, those on Facebook, those on YouTube. Welcome, welcome, welcome. I hope you've had a lovely, lovely day. So this is ATP Live Monday. Um, you're welcome. As you are joining us, please, if you have any questions about the health of your children, start to write the question. Please remember to start with the age of the child. Always important to start with the age of the child and write a short summary of your concerns, and please go straight to the point. Try and ask questions. Don't just give us information without any specific action point, like what do you want us to do with that information. So please always ask questions or whatever information you want us to do with the information you're providing. So, welcome to ATP Live Monday. If you're asking us questions about the health of your children, please remember about the weight of your children, please remember to insert either the birth weight of the child or the current weight of the child. That will make it easier for us to have a context and to be able to advise you as well. So welcome to ATP Live Monday. Hi, I'm Gbemisola Boyede. I'm a pediatrician, and my job for the next 1 hour is to answer any questions that you may have about the health of your children. At the end, if you still have questions, then the time is over. Not to worry, you can actually post your questions on our Ask the Pediatrician Facebook group, and that will be available Mondays to Saturdays and 24 hours daily. So you can actually post your questions there, and we will also be there to answer your questions. So, but that will take you a couple of hours or so before you get your answers. But this is an opportunity for you to get it live and direct straight from the pediatrician. So welcome and welcome. I hope you all had a beautiful Children's Day celebration last week for our children. Okay, so I think I'm done with all my sharing, all my pinning, and everything. I was using that to just all my talking was just to make sure that I'm doing all the sharing and pinning and making sure everybody can see. Thank you so much, Rukayat and Modesta, for joining us from Facebook. And thank you so much for all the Instagram people. I can't mention all your names, but I'm going to start answering the questions now because Instagram questions tend to disappear. All right, so the first question I'm asking is from Makeup and Beats by Jake Cord. Good afternoon, ma. What's the major cause of constipation in an exclusive breastfed baby? Okay, so as much as possible, I would rather you tell us what is the issue with the baby, and rather than telling us what it is, rather than saying it is constipation, because I really want to be sure you are defining that what you are saying is actually constipation. For example, babies on exclusive breastfeeding may not pass stools for days and even up to 2 weeks, and that is not constipation for them. Okay, so because when they eventually pass the stools, the stools will be soft, or it could be thick or pasty, but it won't be hard. And so that is still normal for babies on exclusive breastfeeding. So we don't call it constipation. So if you want to ask question about the bowel movements of your baby on exclusive breastfeeding, just tell me what the baby is doing, how many times the baby passing through, or when baby did not pass through, and when baby eventually passed the stools, how is the texture of the stool. So that is the most important information. The baby's training to pass through is not constipation. All most babies, newborns will make that sound as if they are straining, and but when they pass the stool is soft, it's not hard. So that is not the definition of constipation. Constipation is a baby who is not passing stool frequently and the stools are hard. So there are two things about constipation. Number one, the texture of the stool. The stools have to be very hard, almost like pellets, that kind of picture, and not being passed frequently. So your child's stool is normal, soft, pasty, thick stool. That is not constipation. And for babies on exclusive breastfeeding, they may not even pass the stools every day. That is not constipation. So babies on exclusive breastfeeding really, really have constipation. And all those noise and theatrics made when passing stool or even urine sometimes is not a definition, and does not mean the children are struggling to pass through, does not mean they have any constipation. It's something that babies do. So we're not going to, well, please stop putting cotton bud in the bottom of your baby. That's a very dangerous behavior. Please don't. Just let the baby pass the stool on his own and keep breastfeeding. Don't give any other medication, water, or anything else. Just breast milk only. All right, let's go to Miss Debbie J. Good evening. What can cause a 1-year-old to have convulsion twice in a week? There are so many causes of convulsion. So there are two big categories. We have convulsion that comes after fever. We call it febrile convulsion. We also have convulsion that comes without fever. Okay, so we call it afebrile conversion or afebrile seizures. It is very important for you to for know that. That's the most important information we need to know. This conversion, is it happening after the child body is hot, after fever, or is it happening without fever? Because when the child, some children, when they have fever, and the fever can be from anything as simple as malaria, cold, infection, and all that. And if the fever is high, the child will have convulsion. That is febrile convulsion. And that is something that is runs in certain families, and some children will outgrow it. The most important thing is to always bring down the fever and to treat the underlying cause of the fever as soon as possible. But if a child is having convulsion without fever, that is what we call a febrile seizure. And if the child has had it twice, that is a seizure disorder or epilepsy. And we really need to see that kind of a child, because we have to do certain investigations. We may be able to find out the cause. Sometimes there is no cause. So epilepsy can run in family and there is no cause. Sometimes there may be abnormalities in the brain of the child. Sometimes there could be other medical condition that could make a child to have seizures. Those children who have convulsion without fever, that is a serious condition. That child has to be seen by a pediatrician, because we need to put that child on a medication to stop the child from having the convulsions. And we may also need to investigate the cause of that convulsion And if it's something we can treat, we treat. If it's not something we can treat, well, at least we have to treat the seizures itself. So you are saying that this child is not having fever. So this child is having, so the child has had what we call recurrent seizures, afebrile seizure. That is the definition of epilepsy. That child has to go to the hospital. That child has to see a pediatrician, preferably a pediatric neurologist. We need to do things like EEG. We may even need to do a brain scan, depending on what we found from the history. And then we will need to treat that child. That child has to be put on medication. So this is something that has to happen straight away. So if you have if you have not been to the hospital after today's broadcast, you can start going to the hospital, or at least tomorrow morning you got to see a pediatrician. All right, I'm still coming to Facebook. Let me just take a couple more questions on Instagram, and then we will come back to Facebook. So, Emirate Artistic, what could be the cause of a 1 year old who usually have this wound? It comes out, then has water turns to. So, Emirate, you have to take a picture of this wound and post it on our Facebook group. We need to see it, okay? We need to see it, and then we can. There are many things that could be going on. It could be popular urticaria, it could be some allergic conditions, it could be other things, it could even be bacterial skin infection. So take a picture, post it on our Facebook group. Alternatively, you have to see a doctor who will look at it for you. Then Sandy Ife Emma, please, my baby is 7 weeks old, 4.8 kilos, was born with no hair in the front and other places are full and normal. Please, what can be the cause? There's nothing to worry about. Some children are born without hair at all, and some children, as long as the child does not have like any abnormality in that area, like any discoloration in that area, or any rashes or scaling. If it's just baby was born that way with no hair in a particular part of the head, it's normal. Sometimes after a while, you can cut the hair. Then when their hair grows again, they may grow hair all over. So, but you can ask your doctor. Obviously, if your baby was born with it, that means that the baby was seen by a doctor when the baby was born. All babies must be examined at birth. A doctor must have a look at all babies, and so just let them have a look. As long as there's nothing wrong, there's no scalp rashes, there's nothing wrong on the scalp that's caused the hair loss. It's just that that's how baby is. Then it's just a normal variation, and there's nothing to do, and we can just watch. If you're worried about the cosmetics and aesthetics, you can cut the hair. And some babies, when they grow hair again, they will grow hair all over. So it's not something that's to worry. All right, so let me quickly run to Facebook before Facebook people start getting upset with me. Thank you. The first person is from Sonny or Somi. Okay. Obimba. Say good evening, ma. My baby is having diaper rash for a while now. How old is your baby? And it hasn't cleared completely after. I always start every question with the age of the child. And if your child is having diaper rash, so sometimes for things like this, we can't always take your word for it. Okay, diaper rashes happen because you are not changing diapers, okay, or you are not applying what we call the barrier cream. So um when it comes to diaper area, we need to change it frequently when they are wet, not only when they are soaked. I know there is economic crunch, and sometimes mothers will try to prolong the use of this diaper for as long as possible. But please change the diaper once it is wet, not only when it is dirty, like there's a pool inside. That is number one. Two, when you're changing diaper, please wash your hands. Please apply a barrier cream like pseudo cream, Syncozyme, your Vaseline. Please don't put powder in the diaper area. Just it has to be a barrier cream, something that will prevent the direct contact of the poo or the wee with the skin of the child. So you need to change it frequently. You need to put something that will prevent the contact of the urine and the poo with the skin of the child, because that is what is irritating the skin and is causing the rashes. So if you are doing that, your baby will not have diaper rash. Now, if your baby has rashes in the diaper area, it may also be due to not like diaper rashes, may actually be due to real infections like fungal infection, bacterial infection, which has nothing to do with the diaper itself. So they are just skin rashes, but or skin infection happening around the diaper area, and the treatment is completely different. It's not going to go with pseudo cream, it's not going to go with changing diaper. Those ones have to be treated properly. So we need to give either antifungal or antibiotics depending on what it is. So from what you're saying now, if it's reddish kind of rash, it could still be diaper rash, but we need to say, because it could also be something like a fungal infection, like what we call candidiasis, and it will look red as well. So those ones are not going to go with changing diaper, applying pseudo cream. That child needs to see a doctor who will prescribe appropriate either antibiotics or anti-fungal treatment. So those are the two kind of rashes that occur in diaper area. You have the proper diaper rashes, but you can also have rashes that are due to infection, but happening around the skin area. So we really need to know which one is which. So let's if you're not, since you've gone for 2 weeks, I would say most likely it's not diaper rash. It is most likely skin infection. You're telling us that you've been changing diaper frequently and all that. So it may be a skin infection. So you need to see your doctor. All right, Egba Modesta, my baby's hair is changing color. Always start every question with the age of the child. It is the most important information for a pediatrician. I always need to know the age of the child I'm answering a question for. It is so important, because the answer it gives sometimes vary depending on the age of the child. So this baby that is changing hair color, I need to know the age of the child. That's number one. Number two, I need to know the weight of this child, because color changes could be a sign of what we call malnutrition. Okay, so we need to know the weight of the child as well. So it is non-normal for your baby's hair, and you didn't tell her what the color was before. I assume it's a black hair baby and it's changing to brown. That is definitely not normal. That will worry any pediatrician. So we really need you to tell us age, weight of the child, and whether there are any other health issues this child is going through, so that we can address it as well. Okay, Christy, Mike, Hade, okay, you said, please, is immunization for children a must? Yes, it is a must. Okay, it is a must to protect your children from infections. So there are what we call children rights, child rights, and we have dealt with it in the past, but maybe we'll revisit it again. So there are rights that children have. You think they are your children and you have the power and control, but they also have rights. They have a right to life, they have a right to name, they have right to protection, and that includes the fact that you must protect them from anything that can harm them, and that includes immunization. So you are going to be found negligent if your child has a condition that is preventable by immunization, but the child has that condition and, God forbid, died from that condition because you refuse to give the child the appropriate protection by taking the child for immunization. So there is a law that protects children, and that law says you must give your children immunization. Okay, so please take your children for immunization. It is a must, because most of these conditions that we're giving immunization for, they are what we call childhood killer diseases. They are things that kill children, and so why should a child have them and die from them when we can easily protect them by just giving them injections? So please, it is a must. You cannot choose. Yes, you are not going to choose not to immunize your children. Okay, so you must give your child immunization. I know there are lots of misinformation online. There are lots of what we call the anti-vaxxers, and this is what is happening now in Europe and other countries like US, for example. And I think one pediatrician in US recently has his qualification removed because he was one of those people promoting don't give your children immunization. See, most people are not having these conditions in US and UK because of years of people taking immunization, but people were now beginning to take it for granted, and people are beginning to say all sorts of conspiracy theories about immunization, not taking their children for immunization. Now we're beginning to have in UK, in Wales recently, outbreak of measles. These are things that don't happen in advanced countries, but we're beginning to have them because of this kind of mindset due to all the wrong information. But take it from me, immunizations are good and they protect your children from all those diseases, and there's no reason why a child should die from conditions that the child should be protected from. So don't listen to the anti-vaxxers or people who are telling conspiracy theories. If anything happens to your child, you are going to blame yourself and for listening to the wrong people. So trust people that have your children's interest at heart. So you don't need to give your children any multivitamins. Let your children eat good food. Okay, let them eat vegetables, let them eat fruits. They are going to get all the vitamins from there. There's really no need for you to buy any tablets or syrup in the pharmacy. The natural, the better. So if your children eat their vitamins from the fruits and veggies, that is better. We don't recommend routine what's it called? We don't recommend routine supplementation with vitamins and all that. Okay, Instagram people, ask your questions. I'm just checking just in case I didn't miss anybody's question. Feel free to ask. All right, let's move on to the next question, Rukaya. And well, sorry, before I move on to the next question, I was not here last week, but we did a presentation on HPV. Just to remind us that currently for the girls in Nigeria, we're doing the human papilloma virus immunization campaign, and I'm sure you've had the news in your schools, in your health centers, asking you to bring your girls for HPV vaccine. And I was online randomly minding my business, and I saw people telling another parent, telling another mother that they should not take their children for the HPV vaccine, and that was very, very sad to see. You know, it's one thing for you to have your own doubts, but please don't spread wrong information. Okay, HPV vaccine protect your children against HPV virus infection. HPV virus has been found as the number one some the that is number one thing that is implicated in the cause of cervical cancer. Okay, cervical cancer is the second most common cancer killer of women. Okay, 99% of people that have cervical cancer have HPV infection. So there is a direct cause and link. These are things that have been documented. These are things you can research. We are all living in the information age. Nobody has an excuse for ignorance in this age, because all you have is just as a tip, you know, on your web search or something. Just Google it. You have that information. So nobody has excuse for ignorance. So cervical cancer is something that has been linked to HPV. Now, when you have HPV vaccine, you're protected from HPV infection, which is the most common cause of cervical cancer. So when you give your children this HPV vaccine, you're protecting your children from cervical cancer in future, and they are going to thank you for it. All right, it's not just promiscuity that will cause cervical cancer. All right, we are seeing young women die from cervical cancer. They've not been sexually active that long, so it is about the HPV infection. So it's so important, and these are vaccines that have been taken for years in other parts of the world. So it is not like it's a new thing. It's just that the Nigerian government is just waking up and joining and realizing the need to give our children this vaccine and making it available. So if the government is making efforts trying to protect our children, making these vaccines available for free for you to, the minimum we can do is to take our children for this vaccine. So I have taken it, my daughter has taken it. Please take your children for it. It doesn't cause any harm to your children. It doesn't cause infertility or whatever lies people are spreading. It protects your children from HPV infection and cervical cancer, which is the second most common cancer in women, and it's a killer. So why do we want our children to go through all that pain when one jab would have prevented all that? So please don't listen to all the fake. Don't rely on people who have no business advising you on health issues. Don't listen to your fellow parents when it comes to health issues. They are not qualified to advise you. They are as ignorant or even more ignorant than you yourself. So stop asking those kind of questions from random people. Ask the professionals. Google professional website, Google UNICEF, WHO, hospital website, NHS. Those are the places to get the right information about health. Not asking the same parent who doesn't know nothing. So ignorance kills, which is one of the things we try to address on this program. So please take your daughters for the HPV vaccine if you have not. It's not going to cause any harm. It's actually going to protect your children from cervical cancer. So I decided that we replay the previous recording on HPV vaccine and cervical cancer. If you have not listened to it, it's still available on our Instagram Live, YouTube channel, Facebook. Just listen to it again. I spent an hour discussing it, explaining it, and why it's so important for us. Pediatrician Association of Nigeria, all the health professionals, we're campaigning about it and we're informing you. We're not going to lead you astray. We want your children to be alive. We don't want them to die from cancer, and that's why we want them to take the vaccine. Okay, so, and the government is paying so much for it. It's free for you, but it's not free. There's no free lunch even in Freetown. So make sure that the minimum you can do is to act responsibly and take your children for this immunization. All right, I think I've done my random acts of kindness for the day. Let's move on. All right, Rukaya used to say maybe 7 months or doesn't take pap without much sugar. Number one, it's not compulsory for your baby to take pap. Number two, when you say much sugar, I don't understand that. I definitely don't want you loading your baby with sugar. You can add sugar to the pap just to taste, but not much. That your adjective much sugar worries me. So number one, it is not compulsory for your baby to take pap. There are so many other cereals that your baby can take apart from pap. Number two, you can add a little bit of sugar to give it a taste, but there are other ways you can sweeten your pap. You can add date, which is a natural sweetener. You can use the normal formula, to add to the pap, and it will still give it taste. So please don't overload your baby with white sugar. Okay, so please, that's what you need. Please don't give honey. Honey is not recommended for children less than 1 year. So let's remember that. All right, Faith Ocon, my baby is 5 weeks old, best weight is 3.1. She has something like eczema around the neck. And we need to see when it comes to rashes, unfortunately, we have to see. Okay, and we can't see on this platform because you can only put in comments, you can't put in pictures. I don't know whether Facebook or how the platform will eventually do that. So but right now, what I recommend that you need to put a picture of this so-called eczema, take a picture of it nicely and put it on our Facebook group, Ask the Pediatrician Facebook group, and we will try and look at the picture and advise you. There are many things that can cause rashes around the neck. Things as simple as itch rashes, to the fact that the child is reacting to the products you are using, to the fact that the child actually has skin infection, like fungal infection around the neck, the skin fold area, like intertrigo and all that. So for rashes, we have to see it, and we need to see it first. So take a picture, show it on our Facebook group. We will look at it and advise you on what we think is going on. Okay, there's a question on Instagram, because Instagram questions tend to disappear. I always like to answer them quickly. Larry C is saying, I noticed dandruff on my newborn's head. So what Larry C is describing is most likely what we call cradle cap. Cradle cap is that situation where you see your babies, newborn babies especially, they tend to have what look like scales, like dandruff, coming off. It's very common. So what you need to do is you can use a baby shampoo. There are shampoo for most of us. We don't. Some of us, not most of us. Some of us wash our babies hair with the bar soap. That is not actually appropriate for newborns. There are hair shampoo. It's liquid. Liquid is always better. So you can use it to wash the baby's hair. When you finish washing it, it will soften all those scales, and then you can gently comb it out. Gently comb it out, and that's what you will keep doing daily until it's all out. To make it easier, sometimes you may just apply olive oil in the evening so that it will soften the scales, or even coconut oil, and then in the morning you now use a shampoo to wash it, and then you gently comb it out. Most of the cradle cap will respond to that. However, some children have a complex one. If that is not working, you have to see the pediatrician. We can recommend some antifungal hair shampoo for the baby to use for a short period to quickly hasten it. So, but that's for very bad, severe ones. But most of them, just ordinary hair shampoo, gentle combing will take care of the cradle cap. So I hope, Larry C, you got that correctly. All right, let's move on. Mary Festal say thank you for this session, ma'am. Is it necessary to deworm children? Mary, where are you? If you are in Nigeria, yes. If you are outside Nigeria, no. Okay, so the recommendation for deworming children is based on what we call the worm infestation endemicity of the area. So there are places that worm infestation is quite rife, is quite common. So many people are prone to having worm infestation in those areas. So the World Health Organization recommends that children in such places should be regularly dewormed. Nigeria is one of such places. So we have to regularly deworm our children every 6 months, because worm infestation can cause malnutrition. So the children are eating but they are not getting weight because the worms are eating all the food. It can cause anemia, shortage of blood, because some of these worms, they actually suck out blood. Too much worms, it can cause obstruction, and the child will end up in the hospital and we need to do surgery. Yes, worms can cause that. Some of these worms, can go into the brain of the child and cause seizures. So worm is one of those terrible, they look like it's a minor thing, but it can cause terrible stuff. Malnutrition, anemia, obstruction of the stomach, of the intestine, neurocysticercosis, causing problem in the brain. All this could be avoided by simple hygiene and deworming. So that is why, things that will not cause us anything, it's better to avoid all these terrible things I listed by a simple procedure of giving your child one expeller twice in a year, every 6 months. So if you live in Nigeria, you live in most of sub-Saharan Africa, you have to deworm your children every 6 months. So people who live in UK, US, they don't routinely deworm their children because worm is not a big deal for them. So they will only do it for children that really have it. But apart from the warming, pay attention to hygiene, hand washing, washing food, washing the fruits, veggies before we eat them, because most of the eggs and liver of these worms, they are attached to all these fruits and veggies, so we need to wash them before we eat them. And also making sure our children wear shoes, because some of the worms are in the soil and they can penetrate the feet of our children. I know most of us in Africa or Nigeria believe, oh, our children should play with the sand, they should play with it, there's nothing wrong with it, but they can also get worms from that. Okay, and that is why you really need to deworm your children. Make sure they wear shoes, so that they are protected from the worms in the soil. So yes, we have to deworm our children. And what are the effects of not deworming your children? The consequences of worm infestation, ranging from malnutrition, ranging to anemia, obstruction of the intestine, brain infestation, and so on and so forth. So that is why you have to deworm your children. It's something that easy to do, and it will save you all these complex issues. Egba Modesta say I would like to know too. Okay. I didn't know what is Egba Modesta's question. Okay, they want changing color, but she didn't tell us the age of the child, so feel free to update the question about that child hair color changing. All right, let's move on to Sarah. Edosa say my 8-month old baby has stopped eating any liquid or puree baby food except adult solid. I don't see any problem with that. So there is nothing like baby food or adult food. Food is food. Okay. What matters is how you present the food to the child. So most of the so-called baby food, you see the same rice, you see the same millets, whatever that they maize that they make into a form that is easier for children to take. So, and as children get older, they stop taking the liquid and the puree, then they can eat real solid. So as long as your child is eating food, food is food. There's no baby food, there's no adult food. As long as your child is eating food and eating variety of food, so it's not just only one class of food. So if you listen to some of our previous ATP hour videos on complementary feeding, we've talked about the 6 classes of food, talk about the carbohydrates, the protein, the fat and oil, the veggies and the welfare food, the fruits, and even the dairies and all those different classes of food. As long as you're making sure your child is eating all the variety and not just only carbohydrates, and you're mixing it properly, then your baby is fine. So the baby doesn't have to take liquid or puree, that is fine. So the most important thing is that this your hard or solid food. I hope it's not just rice and beet and a bar and semo. No, I hope they're adding veggies, you're adding fish, you're adding meat, you're adding all the other classes of food. So if your baby is taking all that and you are still breastfeeding, that is okay for the baby. So if you want to clarify, Sarah, please clarify. But we don't have any problem with the texture of the food as long as baby is able to eat it. All right. The next question is from Okoye Elizabeth. Nkechi. Good evening, ma'am. It's nice and educative to always listen to you. Thank you so much. My 15-month-old baby missed her 15-month immunization for the 20th of last month. Can I still take her for it tomorrow? Yes, absolutely. If your child has ever missed immunization, please take the child as soon as you remember. There's what we call catch up of immunization. So if a child missed immunization and then you remember, the day you remember, just take the child to the hospital. We can always give it again. So we call it catch up immunization. So don't say, oh, the child has missed it, that's it. No. Please go back to your health center. Tell them you forgot. They will give the child and the child will still be protected. But please try and remember to take your immunization on time. These days, we have no excuse for forgetting immunization. Please, we have smartphones. We have reminders on our phones. We have all these calendars. So you should put this in your phone. Put the reminder. There are apps that can remind you of immunization. Private hospitals, sometimes they will send you SMS and all that. So your child immunization are things you need to remember. So please put it in your phone as a reminder. But more importantly, not to worry. If you've mixed any, go back and take it. So measles and immune system immunization, measles 2 is what we give at 15 months. We will still give your child. All right. There are some immunization that cannot be caught up if the child has passed the age. So, but there are only few of them. But majority of the immunization we can always still give you. But the one you missed, you can definitely go take it. All right. Let's move on. Right, Matt. Um, my 6-year-old daughter, last week she was urinating and a drop of blood from my anus. What's the issue? No, that's not normal. It is never normal for a drop of blood to come out from the anus or from the urine side. It's never normal. You have to take that child to the hospital. We need to check. I know you may think, oh, there's no more blood coming, but there are blood that you also can't see with your eyes. So the fact that you've seen with your eyes, we have to check that there's even not the ones that you are not seeing with your eyes in the urine. We need to check there's no wound around the anus. We need to check so many things. So please, please, you have to take this child to the hospital. I wish you have done that since that last week, but anyway, it's not too late. At least go to the hospital, let them have a quick look at the child, check the anus, check the bladder, do urine tests, do whatever tests we need to do. And if everything is fine, we will tell you everything is fine. If there's nothing that is if there's anything that is worrisome, we will let you know how we will address it. But there are some things that once you see, you have to act. Seeing blood from the anus, from the urine, it is never normal. Those places are not meant to have blood at all. So if you see it, you have to act on it. All right, Joy Tickle. You say good evening, dog. Thank you for the good work. You the kids do. Thank you. Are children born naturally with fungi? No, children are not born with fungi. Children are born without any of those germs. Those germs are in your house, on the surfaces, in the hair, on the floor, everywhere. That is why hygiene is so important. That's why we need to wash our hands. That's why we need to clean our houses, because the germs are everywhere. Okay, that's why we even need to take immunization as well. Okay, so children are not born with fungi, and no child should be given nystatin at all. Never. That should never be done. No child should be given nystatin for 3 months. No, your doctors are not. Where did you get that from? You need to speak to whoever is asking you to do that. Okay, so that is even a very dangerous thing. We shouldn't be giving children antibiotics, antifungal for absolutely no reason. So there must be something that is making whoever is giving you this medication to do that, and they need to explain it to you. Okay, I always tell parents, I always do anytime I have opportunity, whenever they give you drugs, you must ask certain questions. You don't just take drugs, and some of us are very comfortable once they give us drugs. Bam, we just go with it. Why is my baby going to take this drug? What is it we're trying to achieve with this drug? What is this drug for? Why is my child taking it? What is wrong with my child that the child needs to take this drug? 2, for how long am I going to use this drug? 3, what are the side effects of these drugs? When should I come back? If the drug is not working, or if the child has any symptom, what are the side effects that should make me stop and come back? You must always ask those questions from your doctor. Your doctor has a duty and responsibility to tell you all those answers. So don't tell. I know most parents will tell me, doctors are always in a hurry, they're always busy, they don't want to answer me. No, please, you tell them it's your right. As a patient, you have rights. And as health professionals, we have responsibilities. So it is my responsibility. This is why some of you that know us already on ATP, we don't prescribe medication on the group, because there's a responsibility that comes with doing that. So when I need to give you drugs, I need to tell you why I'm giving you that drug. I need to tell you what that drug is meant to do. I need to tell you the side effects of that drug to watch out for. Okay. I need to tell you when to come back to me. I need to tell you all that. I must explain it to you. Also give you information leaflet self to go with it, so that you understand everything I've said. So this is how it must be done. So I'm not sure why your doctor was given 3 months of nystatin, but it is definitely not something doctors do. Babies are not born with fungus. If your child is born with a condition that they are worried about immunity and the child will get exposed and all that, yeah, they can explain that to you, but not just put a child on antifungal for 3 months. That doesn't make sense to me. And green stools is not a sign of fungal infection. All right. If a baby on exclusive breastfeeding, green stools means you are not giving your baby enough breast milk, not because it's a fungal infection. So please, let's be careful the kind of doctors. I'm sure some of you have seen the news recently. There are fake doctors all over the places. Okay. So that's why sometimes I always recommend just go to government hospitals. At least government hospitals, they have some check and balances in place. Before a doctor comes in, they have to check, you have to confirm that you actually get your degree and all that. So some of these hospitals, some of us use, some of them are being run by fake people. So because otherwise you really need to be sure where you go. But it's your responsibility as well where you take your children to. So you have to make sure you're doing the right thing. So this Joy, I'll recommend you see a pediatrician first and let them have it and talk to them through all this you've said here, because I'm not really sure what is going on. Uh, yeah. Rhoda is saying, at what age can they take the vaccine? Which vaccine? Are you talking about the human papillomavirus vaccine? Yes, children can take from the age of 9 years. So usually we start giving to them from the age of 9 years. Some even give it as early as from 7 years. But I think Nigeria now is 9 to 11. That is when we ask you to give. Faith Okon is calling her friend. Thank you for calling them. um let's go on. A child going to 9 months without it, is this normal? Yes, it can be normal. It's nothing to worry about. Some children may not have their teeth until they're about 13 months old, and it's perfectly normal. We're not worried. Don't worry, they will eventually have the teeth. So but you can see the dentist when a child is 1 year old. The dentist want to see all children, teeth or no teeth. They want to see them at the age of 1 year for their first dental check. All right, Arni Kweze Fenwa. So, can I add Tylenol, date, Tylenol, ginger? Please avoid adding too many things to your baby's pap, okay? Number one, for everything you need to add, you need to be sure first that your child is not going to react to it. But when you've added 10 or 20 things at once, how are you going to be sure this one is what the child is reacting to? The idea is that when you want to add something, add one thing at a time, okay? And it's not compulsory for you to add all these things to your baby's pap, honestly. So some children don't like the flavor of ginger, it's pepperish and all that. You don't need to punish it 9 months old. I know most of you like all those things as adults, but please, children don't need all those pepper stuff. They don't need all those spicy stuff. All right. So your normal plain pap will be fine. You can add your milk. You can add your little bit of palm oil. You can add a little bit of taste. You can add dates to sweeten. But when you're adding things, make sure for every new thing you are adding, you do it one at a time to make sure that the child does not react to it before you continue. So that is just the advice on that. And baby's food is not just pap. We tend to focus more on pap, pap. I get a lot of questions on pap. Add this to pap, 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 pap. It is not written in the constitution that baby has to take pap. They don't have to take any pap. Okay, your children need to eat food. Okay, pap is just one of the food from the carbohydrate family. There's still rice, there's still yam, there's still millet, there's still so many other things in that class of carbohydrates. Please let the children eat other things. There's potato, Irish, sweets, whatever. They're all there. So it's not only pap, pap, pap. Then remember all the protein. It's either the plant protein, like your granules, like your beans, the animal protein, like your meat, like your fish, your crayfish, your chicken, your egg, all those ones are there. Okay, remember your fat, so it could be a little bit of butter, a little bit of palm oil, those ones are there. Remember the dairy, the milk, your breast milk, you can even give yogurt, you can give all those things. Remember your veggies, all the veggies, all the fruits. So you must make sure you're giving your children, you are consciously giving them at least at every meal there must be four out of those six classes of food sitting on the table. There must be four, not less than four of them. So if you're giving pap, you must make sure you are giving protein. Are you going to add egg to the pap, or what are you going to add? Are you going to put in some banana or some grapes, some apple? What is the fruit? Are you going to add some veggies? Are you going to add the milk? There are, just have to think, or you're going to do akara to go on along with it. That will be the plant protein. So you have to think of all the classes of food. I actually don't recommend the food timetable for parents, because everybody has the different classes of food they eat and the different variety they eat in their own area. So you go with what goes with your taste bud, but always be mindful of the classes, always be mindful of the representation of those classes of food in your child's plate. That is what is most important. And we have a little bit of the percentages. Usually we need more of the carbohydrate, maybe 30-40%, when then the protein 15 to 20%, and then of course the fat is very small, and of course the fruits and vegetables maybe another 35 to 40%, and then of course the dairy, the water, those will be fine. So just be mindful of all that. All right, Egba Modesta, maybe it's a year, 3 months old, so your baby is 15 months old. The hair wasn't too dark at birth, though. Again, please prescribe one medicine. You don't need prescription for one medicine. You can walk into any pharmacy shop and buy one medicine. It's one of those medicine that will give you permission to use without a prescription. Just the same way you buy your paracetamol, even your anti-malaria in Nigeria, you don't need a prescription for it. So one medicine, you don't need prescription. Go into any pharmacy. I need one Mespelar. There are different of them. We have albendazole, we have the combatrin kind. Just buy any of them. Just ask the pharmacy, what's the quantity I need to give my child. My child is 15 months old. What quantity should I give? So they should be able to tell you that. Sometimes it's written on the body as well. So, but otherwise, you don't need a prescription for one Mespelar. Okay. So for your baby's hair, I need you to go and see a doctor. It is important to have a look at your baby's hair. You've not told me the weight still, and that is important information which you have still not told us. But they need to definitely have a look, because we need to make sure your child is not having what we call micronutrient deficiency, copper deficiency, malnutrition. Those are the things that changes color of children's hair. Of course, I understand the children hair may not be black, as some people have light color hair and all that, but that would have been the color of the child's hair from the beginning. So the key word or the key information in your question is that this baby's hair was like this and it is changing. That change is significant. We really need to be sure it's not something going wrong. And the way you said it, any pediatrician will be worried, and we have to see the child. We need to be sure the child does not have malnutrition, does not have copper deficiency, does not have this micronutrient. We need to check. So I'm going to recommend you do that, please. It's so important. All right, Faith Okon say, good evening. My baby, a friend of mine has a baby boy. He's 1 year but can't sit, no walk, no tools. Okay, what can be the cause? Number one, I won't be able to tell you the cause because it's your friend's baby, and there are information about this baby you don't know, which you can't tell me. Okay, so the only thing I can give you is a generic advice. So if a 1 year old child is not yet sitting, that child's development is delayed. Okay, that child needs to see a pediatrician. Why the child's development is delayed, I can't tell you, because there are questions we need to ask the mother. What happened during the pregnancy? What happened when the baby was being born? Was there any health issue? Did this baby have these jaundice? Does the baby have infection in the brain? There are many questions. Did the baby cry when the baby was born? Was there oxygen going to the brain? You don't have that information because your friend's daughter, and they won't tell you all that. So you have to tell your friend, the pediatrician said your baby has to be seen. If they have, that's if they have not gone already anyway. So unfortunately, we don't answer third party questions because health issues are confidential and you cannot be asking on behalf of them. So the only thing you can do is to advise them, take your child to the hospital, but you can't be the one um knowing what is wrong with the child. Sorry about that. Okay. Ramat Ibrahim, good evening, Del. My baby is having constipation. What is the constipation? To 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 pull halter. Okay. So at the pulls hard. How many times does she pass stone a day? So this, or in a week. These are information we need to know. All right. So constipation has to do with the food the child is eating. You have to make sure your child is taking food that has fiber. You have to make sure your child is taking a lot of fruits, a lot of vegetables. Your child is drinking a lot of water. Those are the information I need to see first. What are you feeding this child with? Some of us will feed our children with pastries, all this junk food, no water, nothing, and they're going to be constipated now. So let them eat a lot of fruits. Let them eat a lot of vegetables, through all those kind of stuff. Let them eat it. Let them drink a lot of water. You have to remind children to drink water. Some of them don't know. So you need to do all that. If you are doing all that, most constipation will not happen. So, but if you are doing all that and the child is still constipated, then there may be other medical conditions that may explain why the child is constipated. So you have to see us. And once the child is already constipated, which is a challenge with constipation, it's become like a vicious cycle. We need to for break that cycle. So you need to go to see a doctor. They can give laxative. We can give something that will allow all the stools to come out first. That is initial part. But the most important thing is to make sure it doesn't happen again. And that boils down to the food, that boils down to the water, that boils down to encouraging the children to go to toilet immediately they feel the urge. Some of our children will give them too much of this screen, tablets, and all that. They don't want to leave it. They don't want to get out of the TV. So when they feel the urge to go to the toilet, they don't want to go. And then they stay there and the stool will keep piling up and it will just keep making the sensation, the need to go to the toilet more difficult. Then it will, and the more the stool stay in the rectum, the stool storage area, the more water is taken away from it, the harder it becomes, the more difficult. And then when they want to pass it now, it's going to be painful or it's going to cause some, tearing of their anus. And because of that, the child doesn't want to go because of the pain. Then it becomes, a vicious cycle again. So sometimes we just have to break it first, either by giving laxative. Sometimes we have to even go and remove it with our hand. That's what we have to do. So we have to do that. Get rid of that first initial. Then we now have to make sure we teach the children how to go to toilet regularly, make sure they drink a lot of water, making sure they're taking the veggies. So you may have Ramats to see a doctor first, get the laxative, get the first phase out, but more importantly, work on preventing it happening again. I hope that is helpful. Shosha Favor, hi. I don't think I have any question on Instagram yet, but I can see you are listening. No worries. Favor is asking, good job, doc. My 9-year-old is on epilim for 6 months now. She ran temperature 2 days ago and had an attack. Could the high temperature cause the attack? It's possible, yes. When children are sick, they what we call the way the blood is in their system, the system is kind of messed up a bit, so they can always have worsened conversion. But please don't stop her medication, just keep giving her a medication, and that's it. You can always see your neurologist later, but that can happen. So when a child is ill, it can affect their control, their seizure control. So we are aware of that. The doctor may want to look at the dose the child is on, whether they need to adjust the dose a bit more on all that. So what you need to do is to just ring a doctor and let them see her as soon as possible. But it's something that can happen. Okay. Yeah. All right. The next question. Okay. Next question is not coming. Okay, Abigail, please, my 2-month-old poo 2 to 3 times daily and the poo draws. That's normal. There's nothing abnormal in what you've said. What can I do to stop the poo? There's nothing wrong with the poo. Just give your baby breast milk. Please stop the water. Your baby does not need water. Okay. Just give the breast milk only. But baby passing stool 2 to 3 times a day is absolutely normal. They can pass it up to 12 times a day. Absolutely normal. The stool drawing is could be a reflection. It's a little bit, that means a little bit of mucus. It could be a reflection of many things. But it's not something we're going to worry about. Okay. Maybe you're also giving other drugs or other things. So you're also taking drugs yourself that could also affect your baby's stools. But please stop the water. Just give your baby breast milk only. Your breast milk is 60 to 70% water. When you give a baby that's already on breast milk water, you are further diluting the milk. You are taking the space that milk should take, you are taking it up with water, and God help you, you're also giving water that is not even potable, that is not clean. Then you're going to predispose that baby to infection, diarrhea, and all that. All this is completely and absolutely preventable by just giving your baby breast milk only. Your breast milk is 80% water. Stand your breast milk, express it, put it in a clear bottle, leave it for 24 hours. Go and measure how much of it is the water, how much of it is the milk. You'll be able to answer this question. You will notice that 70, sometimes 80% of it is the water. So there is no need to give your baby water again. Please, let's stop falling for this peer pressure of I must give water, or whether it's a grandparent, you must give water. It's not necessary, and it is even more dangerous. Okay, just give your baby breast milk only. Your breast has all the water your baby needs, has all the food your baby needs. It's a complete package, nothing else. Okay, and then your baby will be protected from malnutrition, because when you give water, when the baby is supposed to be taking milk, there'll be no space for milk, and baby is not getting enough calories, and baby is going to not gain weight well. Two, some of this water some of us give are not even clean water, predisposing baby to all these diarrhea, infections, and all that. Exclusive breastfeeding protects your babies from all this diarrhea, pneumonia, infection. So we want you to give breast milk only. So stop the water. Your baby is just 2 months, so you are still young and you are just starting. So please, let's stop the water and just give breast milk only. Thank you very much. Okay, I got a question from Instagram. Good evening. I have a 2-year-old baby. When I bought her, she complains of her vagina paining her. Okay, so usually what you see on the outside is, we call it the vulva, not the vagina. The vulva is what you see on the outside and not the vagina. Anyway, that's just by the way. But we need to know what is going on. So if a 2-year-old is complaining of that pain in a perineal area, we need to check. We recommend that you see a doctor. We need to first be sure. The commonest is not sexual abuse. I know most parents, your mind jump to sexual abuse as number one. No, it's not. The most common thing is actually what we call vaginitis. So children have irritation around that area, and the commonest reason for that irritation is poor hygiene around the area, especially when they are around this age 2 to 3, when they start getting potty trained. So some of them, they go to the toilet and they may not call you to come and help them, and they don't wipe up properly. And some of us wear all these sick nylon pants for children. We recommend you don't do that. We recommend you wear cotton pants for them, so that there's a lot of hair movement and not tight. Avoid wearing all these tight jeans, tight pants, nylon, synthetic materials. Children around the perineal area need to have some hair blowing. And then when they poo, please, let's wipe them from the front to the back. Some of us mothers also don't get it. We wipe them anyhow. No, because the back part where the poo is coming from, it has a lot of germs, bacteria. So the front part where the urine is coming from is sterile. So when you wipe the children and you wipe them forward, you are introducing the germs from the back to their front part. So that can introduce germs and infection and cause vaginitis, which children will often call pain, or whatever because they don't have, at 2 years old, they don't have the right vocabulary to explain what is going on there. So they're just going to call it pain. So most of the time is that irritation, infection, vaginitis. So sometimes the area will look red and all that. That is what is going on. That is number one. Number two, some children actually have worms come out from the back part and go straight to the front part, to the vulva part. And that can also cause that irritation, and they can complain of pain. Another thing is, of course, sexual abuse is always a a possibility that we have to rule out. So we need to ask the children, anybody touching that area, what did they do? Don't ask leading question. Don't tell them, did this person do this? Just ask them if anybody touched them in that area. And what did the person do? Don't give them leading answers so that they would, because children at that age, they will just tell you yes or no for everything you ask them. So you just ask them if they have the language, yes. If not, but more importantly, you can see a doctor. We can examine the child and decide what is going on, whether it's a vaginitis, whether it's worms, or even with sexual abuse. At least we know what is going on. So, but the language they have at that age is very, very limited. So they may not be able to tell you exactly what is going on. They will just complain of pain. Even they will complain, even you touching them, they may complain of pain as well. All right, I think my time is up. It's 7 p.m. Nigerian time here. So I gotta go. But like I said, if you still have questions about the health of your children, we are here for you on Facebook. Please go to our Facebook group Mondays to Saturdays. Post your questions there. Myself, my colleagues will be there to answer your question. One thing we promise you on our group, different from any other group, is the fact that we try to give you answers that are evidence based, sanctioned by the pediatrician. So you will only get that from us. You're not going to get confusing questions or confusing answers. So that is the modus operandi of our group. We try to give you evidence-based answer from a pediatrician's perspective. Please take note of that. So on Thursdays, we'll do another ATP hour. ATP hour is a teaching session. We'll take a topic and we'll go through it. If you want to listen or watch past episodes, it's available on our Facebook page, YouTube channel, podcast platform, Instagram, TV. So feel free to go to all our past sessions and you can watch them and you can learn. You can also read on our website, www.axpediatricians.com. And just remind you that beyond what we do online, we also do outreaches in schools, in communities. So I'm sure most of us have, if we have been to a community near you, we're in all the states of Nigeria doing our community outreaches. And so if you want to support us or be part of it, you're also welcome as well. So thank you so much for joining me this evening, and I look forward to seeing you again same time next week, Monday, God willing. But don't forget to join ATP Hour on Thursday. Just bye from me. Bye-bye. Bye, everyone.